Okay, so the next thing we're going to go over are barrier rules. And this is actually one of our banners, one of our principles. You can see the right there, the barrier rule. Anytime that we're going to use supplies, we have to have a clean place to put those supplies. So remember that we always do our opening. Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to insert name of skill here. Is that okay? I'm going to close the curtain and then go wash my hands. Now, once you've washed your hands, you can then gather your supplies, whatever supplies you need for that particular skill. But once you get your supplies, you have to have a place to put them. So we usually use an overbed table, and that's what this is. Let me go ahead and get this back here. So that's what this is. This is an overbed table. You see these in clinical settings all over the place. But generally speaking, I mean, this one is empty, and they will be for the test. But generally speaking, these things are not empty. They usually have crossword puzzle books and chapstick and cell phones and pens and flowers and lunch trays and all kinds of stuff on these overbed tables. So for the test, they're going to make it easy. The table for the test is going to be empty. You've got it to work with. In a clinical setting, chances are you're going to have to carve out a space on that table for you to be able to use. But that brings up a very interesting thing. With all of those things on the table, it can't be considered clean, right? Because it's been touched by crossword puzzles books and chapstick and cell phones and lunch trays and all these other things. This table cannot be considered clean. So we need to make it clean. Now, you can certainly go grab a Clorox wipe and clean it all down, but that still doesn't satisfy the whole requirement of using a barrier. So for the test, we're going to use a barrier to separate this unclean table surface from our clean supplies. Like I said, you could clean the table, but we use a barrier for more than just a physical separation. It's also to help control any fluids that might spill as we go through the skill. So you want something that's going to be absorbent. Now, you can use anything as a barrier. You could use a paper towel. You could use a bath towel. But for the test, we're going to use a very specific item called a chucks. And that's what this is. Now, these are actually, if you want, their technical name is a disposable underpad, but that's a whole lot of syllables, and nobody says that in a clinical setting. There are two different types of underpads or bed pads. There's a washable one that's reusable, that's fabric, and then there's a disposable one. Now, we call these chucks because they're the disposable ones that you chuck when you're done with them. So that's how it got its name. And most places are going to call these chucks. If you say disposable underpad, they're going to look at you like, what are you talking about? So we call them chucks, but that's their technical name. Now, the reason that we use these during the test rather than a paper towel or a bath towel or something like that is because they are waterproof, but they also, because they're plastic lined, which makes them waterproof, and this side is absorbent, it actually produces a fluid impenetrable barrier between your clean supplies and the soiled table surface. So when you put this on the table, I'm going to turn this around, flip this up. So when you put this on your table, you get the chucks, you open it up, and you put it on the table so that the absorbent side is facing up. So this white side is facing up. You want the plastic side down against the table. And this is what's going to help control the flow of liquid. So if we spill a cup of water, if emesis basin of saliva spills, we have something that's going to keep it from going through and contaminating the table or dripping onto the floor and providing a source of contamination there. So the first thing that we get is a barrier. Now, some of you will try to do it a little bit differently. You're going to do your opening, you're going to wash your hands, and then you're going to go over here to this supply cart right over here. And let's say that we're doing mouth care. Well, we have to have a towel. We have to have an emesis basin, a cup of water, a toothbrush, toothpaste, a set of gloves. There's a lot of supplies that we're going to need for this skill. So if you go over to that supply shelf and you grab a towel and you grab a Chucks that's all folded up, and then you go to your 3-drawer cart and you open it up and you grab the emesis basin with the toothbrush and the toothpaste. You now have all of this stuff in your hands, and you've got to spread the Chucks out on this table, but you don't have 2 hands to work with. What ends up happening is exactly what I'm doing. You end up holding stuff against your uniform as you're trying to spread the Chucks out on the table to give you a space to put this stuff. Don't do that. This uniform is not clean once I start work. It's brushed up against that privacy curtain. It's leaned up against the sink. It's pressed up against the bed and the sheets that are on the bed. It's kneeled on the floor to do foot care. This uniform, once I start working, is not considered clean. So you don't want to hold all of these items up next to your uniform and try to pull this barrier and get it situated so you've got a place to put your supplies, because you will contaminate those supplies. Remember that this uniform has gone in and out of every one of those patients' rooms. And if I've leaned up against the bed in multiple patient rooms, I don't want those germs on the clean supplies that I'm going to be using for this patient. The first thing you should get is your barrier. So wash your hands. So you do your opening, close the curtain, wash your hands, go over to the supply shelf and get just the barrier. Come over to the table, spread the barrier out while you have 2 hands to work with, and then go back and get the rest of the supplies that you need. That way you don't cross-contaminate. But only get the supplies that you need to do the skill, which means that you actually have to learn all of the supplies. Nobody's going to tell you. It's not on the care plan. Care plan is not going to say get 1 towel, 4 washcloths, a privacy blanket. It doesn't tell you the supplies that you need. You actually need to learn those. And those are on the flashcards. So if you get the flashcards, I actually have supply flashcards in there as well. They're also printed at the top of each of the skills page. So you can make your own flashcards if you wish. But you need to learn the supplies. What some people try to do for the test is just grab a whole bunch of stuff and figure it out later. So they go to the supply shelf and they grab 10 washcloths and 4 towels and a privacy blanket to do mouth care. And you don't need all that. Well, remember that you're not the only one testing that day. There are 7 other people testing, and that supply shelf is not magic. It doesn't just repopulate. Whatever's on there is all we have for the entire skills testing day. That's it. So if candidate 1 comes along and uses 10 washcloths, candidate 2 uses 8, candidate 3 uses 6, candidate 4 uses 12. By the time candidate 5 gets in there, there's no washcloths left, and they have to do foot care. Well, what are they going to do? There's no washcloths to do foot care with. So the evaluators aren't going to let that happen. If you go in and you don't know the supplies and you just start grabbing stuff off the supply shelf and making it up as you go along, the evaluators are actually going to stop you and say, you do not need that many supplies for this skill. They won't tell you what you do need. They're just going to say, don't use up all those supplies. Well, if you don't know the supplies that you need, that can really throw you off. I mean, that can make it super difficult for you to get back into the skill, right? It derailed you. So, because now you're starting to think, oh my gosh, I don't know what supplies I need. What do I do now? Am I in trouble? Did I fail? So all of these things are going to go through your mind, and you don't want that additional stress. Learn the supplies that you need before you go test. Now, this is important though, because remember that you guys are all focused on the test, right? You got this big scary test in your future. You're scared to death. What if you fail? It's a lot of money. But I want you to think about the day after the test. When you go to work somewhere, right? Nobody's going to call you up the night before and say, okay, well, you've got a bed bath to do. You've got 3 transfers out of bed and into a wheelchair. You got 4 patients to feed. You've got 3 that need mouth care, 1 that needs to, nobody's going to do that. You go to work at the beginning of your shift, you get a shift sheet that tells you your patients and what you need to do with each one. And you got to know. I mean, you have to know it, because nobody's going to tell you, okay, for that skill, you need 4 washcloths, 2 towels, a patient gown, a privacy blanket, a bath basin, soap, lotion. Nobody is going to walk you through the supplies that you need. So you have to learn this, not for the test. Everybody focuses on the test. That is not why you're learning this. You're learning this because in a clinical setting, you are the one that you're competing against for supplies. If you have 10 patients and they all need total care, you've got to know how many washcloths you're going to need to take care of those patients. If you use 20 washcloths on the first patient, the next 9 may not get any care because you're out of supplies. And you can't just call up and say, need more supplies. There are none. So you have to be a good steward of your own supplies by understanding what you need, because in a clinical setting, you are competing against yourself for those supplies. And if you have no idea what you need for what skill, it's going to be very, very difficult for you in the clinical setting. Make sure that you learn those supplies. So when you're using a barrier, when you have a skill that requires supplies and you're using a barrier, you're going to do your opening, close the curtain, wash your hands, get the barrier first, put it on the table, and then go get the rest of your supplies. But only get what you need. Now, let's say just accidentally you take 1 too many washcloths. You thought you grabbed 4, you grabbed 5 instead. You didn't use the 5th one. What do you do with it? Well, you cannot put it back on the supply shelf. This is a one-way only supply shelf. Once you remove something from that supply shelf, it can't go back, because the minute it's removed, it's considered unclean. We don't know what it's touched. So what do you do with it? Well, you can't leave it in the patient's room. Anything that's out of your sight is not clean. And let me give you a scenario. Let's say that you took some extra washcloths and some extra towels and you left them in your patient's room because you're going to give them a partial bed bath later. His wife is there visiting now. You're going to let them visit, and then once she leaves, you'll go in there and bathe them. Sounds good. So you leave the extra supplies in his room and you put them on the little window shelf right beside the wife's chair. So she's sitting there talking to her husband. They're watching TV. They're, communicating. You walk in, you put the supplies on that little window ledge, and you leave. You say, I'll come back later. Well, as she's talking to him, she accidentally spills her coffee, and she looks around for because she doesn't want to leave a puddle of coffee on the floor, and she knows you're busy. She's not going to call you for it. So she looks around and she sees the washcloths. So she picks up a washcloth and she wipes the coffee up from the floor. But the problem is that we don't have any dirty hampers in the rooms. We don't keep our dirty stuff in our patient rooms. So there's nowhere for her to put it. So she just folds it up and puts it right next to the stack of linens. And then she's going to tell you about it before she leaves. But when she goes to find you, you're on break. So she tells some other CNA and the word never gets back to you. And you go in later because she's gone to give the husband a bed bath, and you see the washcloth. So you just put it back on the stack and you start working with the patient. That washcloth isn't clean, and now the patient has coffee all over them. So you need to understand that anything out of your sight is not considered clean, because we don't know what happened to that item while we did not have possession of it. Maybe somebody coughed on it or sneezed on it. Maybe it was used to clean up a spill. Maybe somebody sat on it. I mean, there's so many things that can happen to these things that are out of your control. So you don't put things into a room to be left for later. You can't put them back on the shelf because that's a one-way only shelf. So if you take something and you don't use it right away, you have to put it into dirty linen. That is a nursing principle, and it probably will show up on the written test. You may have a question that says, You have 2 unused washcloths from a skill that you completed. What do you do with those washcloths? And it's going to be multiple choice. It may be A, put them into the dirty linen receptacle in the soiled utility room. B, save them for later. C, return them to the clean supply shelf. Or D, throw them away. So you know that 2 of those you can throw away, right? They're nonsense answers, so get rid of them. But you may be left with 2 that you're not real sure about. Do I put it in dirty linen or do I put it back on the clean supply shelf? So you need to know that principle because you may get that question on the state exam. So in healthcare, you use it or you lose it. Don't try to stockpile supplies for later. It doesn't work that way. Okay, so anytime you use supplies, you're going to get a barrier. You're going to do that first, get your supplies, put them on the barrier, and then you're going to prep for the skill.